Hello friends, really quick before we get into today's video, I would love a chance to show you my two new color changing glosses. We have Abyss, which is the black one, and Whimsical, which is the pink sparkly one. I'm just going to swatch them for you, show you how they look on and the tint they leave behind. Here goes Whimsical. This is cotton candy scented. Look how sparkly and shimmery, so pretty. Looks beautiful on the lips. It's one of my new favorites. And now look at Abyss. Dark black applies as like a tinted black, and then it turns pink, obviously. And they look really cute. This is after wearing them for about 2 minutes. And now let's wipe them off and you can see the tint they left behind. The longer you wear them, the more tint you'll get. And lastly, I just want to show you how utterly creamy and amazing my shower gels are. This is the sparkling sugar plum one. Smells so good. But watch how a little tiny dab of this goes so far. Take just a little plop, bloop, bloop. And then I'm just going to get both hands wet and scrub, scrub, scrub together. And these are just so soft. They make your skin feel so good. Not dry. It doesn't leave any weird residue. And I have multiple available now on my site, as well as many other things. And right now, all orders are 15% off, and you get a free scratch to win card in your order. Thank you so much for listening and watching this little ad. Now let's get into the video. Hello everyone, Dr. Diamond here. Thank you for tuning in to today's surgery. We have something rather unique to deal with here today. We have our patient who is in fact sedated because they have some type of very unusual, I almost want to say it's like a substance that got on them and like melted to the skin, but it's also seeming like some type of little lesion, scab, like a sticky scab. Really not even 100% sure. So we will take a little tiny piece that we remove and send it off to get some biopsies and testing done. And basically those tests will tell us what the heck this might be. So what we're going to do here today, the patient is sedated because we are removing these potentially painful areas where the stickiness is occurring. Kind of even hard to see, which is why this patient waited so long. If you look, we have one here, 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 and upon touching it, it's like a rubbery texture. Here, 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 here. And I think that might be it. I think I pointed to that one. What we're going to do is our absolute best to go ahead and remove these and make sure that everything is gone and there's no pieces left behind that can regenerate, hopefully. Like I said, don't even know what the heck this really is, but hopefully we'll find out. So yeah, thanks for tuning in to today's surgery, and let's go ahead and begin. I'm going to be using a few different things. You saw my explorer hook here, which will be the main thing that I use to lift. Look at that. See how it's almost like, I really want to call it like a booger. I'm sorry if that's just not right, but look at it. You can't say that doesn't seem like a booger type thing. Yeah, very rubbery. Look at that. Wow, and then it just sticks back together. Okay. Alright, the next thing I'm going to bring out is my syringe of medication. If anyone would not prefer to see the syringe, or you don't like needles or can't observe that right now, go ahead and momentarily look away, skip ahead. We have our medication here in this syringe. And we use, oh great, just throw it down. We use this medication for removing things like super glue when it gets stuck on people, cement type gummy substances, all kinds of things. So if we do need a little extra help, I will use that. But I'm hoping we'll be able to get the majority off without that assistance, because that medication can be a little bit harsh on the skin. We actually had a patient that it left second-degree burn on. And mind you, that doesn't normally happen. It doesn't normally leave burns. But in this case, what happened was the substance that was on the patient's skin reacted obviously very negatively with the medication, and that's what caused the burn. But we learned from it, and we know more now from it. And that patient made a full recovery, no scarring. So we have that out. The only other thing I really need is gauze pad. And the reason for this is whatever we remove, I'm just going to set on this sterile pad. And that way we'll just keep it all in one place. And we'll just take out a few of those. So let's go ahead and get started. I'm just going to begin lifting and removing what we can. I'm going to start here. I'll move these pouches over here. I'm going to start with this one we looked at first and see what we can do. See. Alright, we got a piece off. Let's continue. That wasn't so bad. And I'm just gonna lightly scratch in between to make sure that there's nothing there that we can't see. Like, look, that little piece, couldn't even see it. And let's get the tweezers. And look at that. Got that piece off relatively easy. There we go. Look at that. You see how long that is? Wow. That was a long one. Maybe that's the one I'll use to send for testing. That one was a huge piece. Get this one right here next. You hear that? Wow. I know I keep saying that, but in all my years of practice, I've really never seen anything like this. It's such a weird type of, I don't even know what to call it, substance. Let's try to get this little piece back here. Oh, that broke off. We'll pull the opposite direction. Oh, came off easy peasy that time. Alright, let's go for this spot right here. Okay. And this piece right here is pretty lifted. I think we can go ahead and remove that. Let's see. Yeah, that's gonna be easy. If I can grip it. Ooh. Wow. Alright, and I'm just gonna dig around here, make sure there's nothing else we're missing. Okay, now I'm gonna rotate a little bit here so we can get good access to these. Looks like we got 3 more to deal with here, here, and here. So let's go ahead and see. This one's actually extremely sticky. My Explorer hook keeps getting stuck on it. Let's see about this spot. I think we can get that piece. Yep. Okay, let's see about this piece here. And right now, well, let me see if this piece will come off, and then I'll put the medication on that one. Let's see. Yeah, this one's coming off. And it did leave a little piece behind, so I'm gonna get that. That's a little bit sticky too, but I think we got it. Okay, now for this last piece here, I'm gonna put the medication on it, bringing out the syringe now. Let's go ahead and just put a tiny bit on that. Okay, that was honestly probably too much, but that's okay. And watch how simply easy this is about to remove. Ready? Look at that, like literal magic. Probably should have used that on all the spots, but like I said, we want to preserve it as much as possible in case of any reaction. Just go ahead and dry up any of that residue. Perfect. As you can see, that came clean now. And what we're gonna do is just finish off. Let's move this aside so we can send these off. Look at that. Wow. Wow. What we're gonna do for the last part, just to make sure there's nothing residual left on the skin, is just take this brush and gently circle around and make sure we don't see any little pieces of that lift up anywhere. And if we do, of course, we need to remove it. And this just ensures that we don't leave any behind. As you can see, so far it looks good. I have not seen anything left behind. Has anyone else? No? Perfect. Okay, I think we've cleared the area of any debris, anything that shouldn't be there. Looks really perfect now, very vibrant. Skin looks amazing. That will conclude today's procedure. I'm gonna go ahead and send off those weird things we removed and see what's going on. Maybe next surgery I'll have a follow-up for you on what these are or what that was. But until then, take care of yourselves. Thank you so much for tuning into today's surgery, and I look forward to seeing you again very soon. And this patient is off to post-op for just a little bit of post-op care, and they will be going home with a very, very subtle treatment plan. They'll be perfectly fine. Have a wonderful rest of your day or night. Dr. Diamond